Welcome, everyone. Today, we'll take a closer look at something simple, but powerful, hand hygiene. From its historical roots to today's best practices, hand hygiene has played a critical role in saving lives and preventing infections. Whether you're caring for patients or protecting yourself, clean hands really do make a difference. Let's begin by understanding where it all started, and why it still matters today. Today, we will learn where hand hygiene came from. Understand why it's important for infection control. Know what makes a good hand-washing station, WHO guide. See the difference between wet and dry hand hygiene. Practice when and how to clean our hands properly. At the beginning of the session, we'll start with a short video to explore the origins of the hand hygiene movement and introduce Dr. Ignaz Semmelweis, who is widely recognized as the father of infection control.
After earning his medical degree in 1844, Dr. Ignaz Semmelweis specialized in obstetrics, the branch of medical science overseeing childbirth. 2 years later, Semmelweis became assistant to Professor Johann Klein at the first obstetrics clinic of the Vienna General Hospital. In his new role, Semmelweis examined patients before Klein made his rounds. He also taught students, performed administrative duties, and supervised difficult deliveries. He was sort of the chief resident of his hospital at the time, and it wasn't long before Semmelweis noticed a troubling pattern at the Vienna General Hospital: high maternal mortality rates. There were 2 birthing wards at his hospital, the midwife ward and the physician ward. At the time, midwives were starting to be replaced by doctors in most birthing rooms. Their advanced training and techniques were supposed to be an improvement over traditional midwives. But Semmelweis noticed higher mortality rates among women who had physician-assisted births than those assisted by midwives. The physician ward's maternal death rates climbed as high as 18% and never fell below 13%. On the other hand, mortality rates remained around 2% in the midwife ward. Semmelweis wondered why the old-fashioned midwives saved more lives despite the fancy new techniques that doctors employed. He launched an investigation into why physician-assisted childbirths resulted in more deaths and was startled by what he found. A 19th century hospital wasn't such a great place to give birth. The primary cause of the high mortality rate in maternity wards was a disease known as puerperal fever. Better known as childbed fever, the disease caused abdominal pain, fever, and delirium. Some expectant mothers took to calling it the doctor's plague. Patients would often lie on their back, appearing listless. Other symptoms included labored breathing, a white tongue, and a pulse as high as 140 beats per minute. Nausea and vomiting weren't uncommon. But worst of all, puerperal fever was often fatal. In her 2005 paper for the journal Medical History, accomplished British nursing professor Christine Hallett described it as a great derangement of the vascular system, with as many as 80% of affected women perishing from the disease. Semmelweis did what every good scientist would do during his investigation into the high mortality rates. He began collecting data. After a few years, the data supported his suspicion. Physician-assisted births led to higher mortality rates. And the same thing was happening in other hospitals in America and Europe. Women were 20 times more likely to die while giving birth in a hospital, while home births typically resulted in a less than 1% mortality rate. It may seem strange to think about now, but doctors often began their day working in the autopsy room. After working there barehanded, doctors went straight to the maternity ward. And on the way, they did not stop to wash their hands. Semmelweis thought exposing pregnant women to cadaverous matter was the cause of these puerperal fever infections. His assessment was dead on. Midwives never did autopsies, but both doctors and medical students did them regularly. The evidence implied physicians might have been responsible for spreading the disease. Semmelweis eventually concluded as much. Doctors played a crucial role in causing the infection. So he decided to test his theory by instituting a hand-washing procedure in the maternity ward. In the late 1840s, Semmelweis put his theory to the test. He asked physicians and students to wash their hands before performing autopsies and regular exams. The doctors used a chloride lime solution to clean their hands. It was a strong disinfectant, created from treating slaked lime with chlorine. The 19th century equivalent of using a powerful bleach soap, its base components are still used in laundry detergents and bleach today. With a new hygienic practice in place, the test saw immediate positive results. Semmelweis's hand-washing protocol worked. The death rate plummeted to 2%, closer to the mortality rates in the midwife ward.
Today, we have a much clearer understanding and can now visibly confirm how many bacteria remain on our hands if hand hygiene is not performed properly. This can be demonstrated using culture media or other scan tools. Hand hygiene is one of the most critical practices for preventing the spread of infections. Hands are the primary vehicle for transmitting germs, particularly in healthcare settings where providers frequently move between patients and contaminated surfaces. According to studies by the CDC, 30 to 40% of hospital-acquired infections are directly linked to poor hand hygiene. By maintaining proper hand hygiene, we not only protect our patients from harm but also safeguard ourselves as healthcare professionals. In short, clean hands save lives. When promoting hand hygiene practices, the first priority is ensuring the presence of accessible hand hygiene facilities. According to WHO, accessible facilities must meet these standards. Located within 5 meters of the patient care area. Immediately accessible during patient care. Fully functional, with available and usable soap, water, or alcohol-based hand rub. Must not require staff to leave the care area or open a door to access them. A proper hand-washing station should have running water, foot or sensor-operated. Liquid soap, paper towels. A covered pedal bin. And a hand-washing steps poster. These help reduce the risk of spreading germs. However, we are in a setting where water resources are limited. In places with fewer resources, Africa CDC gives useful and easy ways to set up hand-washing stations. You can check the link above for more information. This is a simple hand-washing station. Use a 20 to 40 liter container with a tap or spout. Place it on a stool, with a basin underneath to catch water. Keep soap nearby. Daily care. Keep it filled with clean water. Refill from a safe water source. Clean the outside daily. Wash the inside weekly with water plus 1% bleach. Rinse and refill. According to WHO, the 5 moments for hand hygiene are: before touching a patient, to protect the patient. 2. Before clean or aseptic procedures, to prevent infection. 3. After body fluid exposure risk, to protect yourself. 4. After touching a patient, to prevent germ spread. 5. After touching patient surroundings, to keep the environment clean. There are 2 ways to clean your hands: with soap and water, or hand sanitizer. Use soap when hands are dirty or after contact with body fluids. Use sanitizer when hands look clean. Soap removes dirt, sanitizer kills most germs quickly but doesn't clean off dirt. Soap takes 40 to 60 seconds, sanitizer takes 20 to 30 seconds. But sanitizer doesn't kill some germs like norovirus, C. difficile, or cryptosporidium. Although hand sanitizer is convenient, there are many situations where soap and water are still necessary. That's why, in any healthcare setting, we need to make sure there are wet hand-washing stations that are easy to reach and use, so staff can clean their hands whenever they need to. Meanwhile, you can keep hand sanitizer at the foot of the bed, on the treatment trolley, or carry a small bottle with you. It's important to have it within reach. Proper hand-washing steps. Wet hands with clean water. Apply enough soap. Rub palms together. Rub backs of hands and between fingers. Rub fingers and thumbs. Rub fingertips in palms. Rinse well with water. Dry with a paper towel and use it to turn off the tap. After watching this video, take a moment to reflect. Is there an accessible hand washing station in your work area? Can you reach it easily when you need to? If not, make a small change. Even a simple adjustment can help protect both patients and caregivers. Enjoyed the video? Give it a like and share it with your fellow nurses. We'll keep bringing you more useful nursing knowledge and support.